Good morning, everyone, and thank you for coming here for a daily briefing of letting everyone know what's going on around the county. I think everyone should have got the message yesterday from Governor Cuomo about how serious this situation is evolving more rapidly than they anticipated down in New York City, and obviously through Westchester County, Orange, Dutch, and Putnam County, and Ulster County, and you know what that means? It's working its way here, more here. So, we're in desperate need of ventilators. Obviously, the president sent 40,000, and the governor's anticipating needing 400,000. The hospitals are set up all throughout New York City. We're making arrangements here for the same thing. We have been for the last couple of weeks, so we're ready. We're going to be, continue to get ready, working in a partnership with the hospitals and hotels. And I do want to say thank you to the hotels. I mean, they have stepped up. Obviously, their occupancy rate's less than probably 1%, but they're willing to keep people on just in case we need to put people in there. And that's what happened with some of the stuff in the shelter when we got to move people around. The hotels have been a great partner in all this, and so has everyone in the county. And I can't thank all the companies that have actually jumped up to the task of helping out and trying to do things differently, trying to make someone's day brighter. And the feedback not only that I get for all of the county cares and the e-cards that people sent to our nursing home, it really was a great impact on the workers up there because it put a smile on their face, took them away what's going on, and it was awesome. I have to thank State DOH and our own DOH and Liza and her team there that have been doing a phenomenal job with this. The Sheriff's Department has been doing a phenomenal job. Everybody, the probation, DPW, all the workers have really stepped up here in Albany County, and I can't thank them enough. But to talk about our numbers, we have been lobbying. I've been lobbying as president of County Executives of America. My national phone calls that we usually have once a day to talk about what's going on around this great country of ours. Everyone's having the same issue. They need testing. They need testing. But I don't want to speak for the doctor, which she said yesterday. Just assume it's here. The testing is coming down to, we ran out of test kits. The test kits they have, they're reserving them for people that need to be tested. They'll triage them as doctors, and they'll decide who gets it, who doesn't get it. Just because you got a sniffle doesn't mean that they're going to test you. Most of this can be taken care of at home, and you won't need a hospital setting. But we literally went from 136 yesterday to 142, so we went up 6. Would it be more than that if we were testing? Probably. But we have to look at the statistics, the amount of people that got tested that were negative versus the people that were positive. Albany County has 557 people under mandatory quarantine, and 10 have been hospitalized. We're up to 10 right now, putting our hospitalization rate just a little over 7%, which is really good, and two people in the ICU. That's what we have to continue to look at. Don't think because when we have these daily briefings that the numbers are going to get less and they're not going to go up as much as they have rapidly every other 4 days when we were getting this because the tests were coming in. The tent at Albany Med was shut down on Tuesday, so them results should be in no later than, actually should be in today or tomorrow at the latest, and we're catching up. So the numbers are only going to go up a little bit each day now because of that reason, because the testing has gone down. But I do want to remind people, please, 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 think about other people. Self-quarantine yourself. Don't go out not necessarily. Go out and take a walk, get fresh air, take your pets for a walk, take your kids for a walk. I'm not saying just sit in your house, but please, the more that we social distance ourselves, the more that we isolate ourselves over these next couple weeks, we're going to slow this down. And I know I say this every day, but I'm saying this for a reason. And I'm saying this because we don't want to overcrowd our hospitals. We don't want to overcrowd our emergency rooms. And the only way we're going to do this is by social distancing, washing our hands, coughing in our arms, and keeping 6 feet of separation. If you listen to the governor yesterday, he said this is probably going to hit by within the next, he said 19 days. So we're looking at April 6th to April 13th till we fully see what's going to happen here in this area and throughout New York State. New York City is going to take off quicker than any place else in this great state of ours. So the people just realize sitting at home that you're looking at about April 13th before we even get to the peak of this. Then you got to go in a couple weeks after that and realize that this is probably going to go on to about May, mid-May, if not longer. So, and the reason why I'm saying that is to get people mentally prepared. It's different. And it's just not about the normal person. It's the first responders, too, that are dealing with a different situation than they normally deal with. So they have anxieties. It's a different world that we're living in right now and going to be living in going for a while. So I tell everyone, take a step back, take a deep breath, take a walk, clear your head, because it's all going to be there when you come back. It's not going away. And it's the same thing with that mental health number that we set up. That's been phenomenal for just people. It's for healthcare workers too. It's for people on the front line that just need to take a little off their plate, because think about them, the hours they're putting in, and what they're seeing firsthand and what they're dealing with. So it is for the first responders also. So keep that in mind. And then, the precautionary number, which is pretty high, tomorrow the Farnsworth Middle School students come off, and that's like 400 of them. So that number is going to drop tomorrow, and none of them tested positive, so which is great. But they come out of precautionary quarantine tomorrow, so we have that to look forward to. Again, I want to thank Gilliland Superintendent and for what she did, delivering all that stuff for us. And Colony Superintendent delivered products yesterday, and they're bringing stuff today. I can't thank the school districts enough, and everyone out there that has supplies sitting around that you're not going to need. Let us get it to the Department of Health. Let us get it to the Sheriff's Apple EOC. Let's get it out to the people that need it. So thank you, North Colony School District. Thank you, Gilliland School District. Thank you for being a great pillar of this community and stepping up when we need you to step up. I just want to give out the mental health number again, just so people are aware of it. It is 518-269-6634. 518-269-6634. 7 days a week, 8 a.m. to 5 p.m. you can call. And listen, any question that you have, please. That's what they're there for. It's different times we're in. And not everyone has the answer. So don't feel like you're alone and you're isolated and you're the only one that's worried or the only one that needs help or the only one that has this type of question. Don't be afraid to ask. If you don't want to ask your loved one, you don't want to say something to somebody, you don't want to rattle your family, call this line and they'll talk to you. Also, I want to thank WMHT. They're providing in-home learning from grades 4 through 12 online for local residents. They stepped up. I can't thank WMHT enough. This is going to be great for kids that are home. Parents, you can self-teach, but also you can sit there and get them online in grades 4 through 12 that can sit there and go through some classes and continue learning. Because the more we stay preoccupied, people staying at home, the easier it's going to be to stay at home. The less fights are going to happen at home, and you're going to get along better. So please keep that in mind. The American Red Cross, some of the questions that we got that were emailed to us, they had concerns saying, is it safe? Is it safe for me to give blood? Am I going to get contaminated? No, no, no. It is very safe for you to give blood. They have the proper PPE. Everything's disinfected. So please call and make them appointments, because the American Red Cross needs blood. They need to get the blood banks up. So everything is safe. Trust me, it's 1-800-RED-CROSS, or go to redcrossblood.org, set up an appointment, and they will address your issues too if you're concerned about anything, and like I said, they'll take care of that. And I want to thank the Downtown Albany Bid, because they put a letter together, a list of businesses in the city that you can support aside from ordering takeout and delivery, but also buying gift cards and everything else. So I want to thank them for that and supporting local restaurants. It's different. You see pharmacists now, Crestwood pharmacists on Whitehall Road. They actually decided to shut their shop to people. They'll deliver to their people. You can you can call them. They'll drop it off to you. But they decided to stop people from coming in because they deal with the senior population about trying to keep them out and keep them at home. I think it was a little bit better driving around last night, but there's still a lot of cars out there. There's still a lot of people going on with their daily lives. And I'm going to say this. Please go online. Look at what's going on over in Italy. Look what's happening in Germany. Look what's happening around the world. Wake up. Wake up. Stop being selfish. Stop thinking about yourself. This isn't a vacation for you to sit home and take time off from work and go out and enjoy yourself. This is a serious situation we're in, and people, please, what's it going to take for you to wake up? Seriously, what's it going to take? I'm not talking to the people out there that have done what they're supposed to do about staying home and staying out of the elements and staying away from people. I'm talking about the foolish people that continue to walk down the streets in groups, that continue to go out and hang out in groups, continue to have house parties, continue to go on with their life driving around like there's nothing going on. Wake up. This isn't fake. This isn't fake stuff being put out there in the media or online. This is real. And you need to wake up. So I want to say to everyone, please, again, please, this is a new norm. We're going to get through this. We're New Yorkers. We're going to get through this together. Working together, we're going to get through this. We're going to get through this by leaning on each and every one. And I have to say this. I have to thank every supervisor and mayor, Paul Mahan. I could call them all out. They've been phenomenal through this, not just working with my office, but working for their people, the legislature working for the people, informed, getting messaging out. That's what government's for. Working for the people and making sure we still function through this time. So I want to turn it over to Liza at this time, and please, everyone, take a step back, look around you, and enjoy what's going on around you, and just remember, take the precaution and stay 6 feet away from everyone. Doctor?
Thank you, County Executive McCoy. So we've been focusing a lot on the numbers up to date, and the numbers, when we were doing widespread testing, gave us an indication of what was going on in the community. And now we're seeing that that's changing as the limitation of testing means we are only detecting a fraction of cases. We know that 80% of people that contract COVID-19 will have a mild to moderate illness, a flu-like illness, and then there's a percentage of people that are pretty much asymptomatic. So we're not capturing the numbers of actual people affected by this at this stage. And that is another very important point to hammer home because, again, it brings us back to the importance of staying home. If you are one of the few people that has an asymptomatic case, it may go well for you, but if you infect someone else, it may not go as well for them. So it's very important to consider source control, which includes the measures that we have discussed to date. Staying home, washing your hands, cleaning surfaces frequently, and just staying a safe distance from others. To date, in Albany County, we have tested 2,886 cases and have had 142 positives. So this is about a 5% rate. As the county executive said, we currently have 10 patients in the hospital who are having a tougher course with COVID-19. I have been in contact with the hospitals, and at this point, the hospitals have good capacity. They have availability of beds, they have availability of ventilators, but this is today. Last week, I encouraged everyone to look at what was happening in Italy to see where we might find ourselves in a week's time. This week, I think we're starting to see this evolve more and more just down the road from us in New York City. In New York to date, as of yesterday, there were 25,665 cases. That's more than half of the cases in the United States. 10,761 of these were outside New York. So we know the bulk of cases that we're seeing are in the New York City metropolitan area. But all of us in this room and all of our viewers know about how much traffic there is on a general basis back and forth between the capital region and New York City. We know that downstate, they are starting to see struggles with capacity in hospitals and ventilators and others. And this is why it makes it an even more immediate need for us to enact the measures that we have been advocating for the past couple of weeks. And I will again continue to assert their importance. County Executive mentioned that Farnsworth Middle School, which was a really large cohort of individuals that we were following, is going to be finished their quarantine. I would strongly encourage parents that just because that date is here, they should not change the behavior that their children, that they hopefully have been enforcing with their children. Children should continue to stay at home, middle school children, high school children. I know how difficult this is. I have 3 teenagers at home myself. And it's difficult, but it's necessary. It is incumbent on all of us to know how important this is to protect others, to save lives, to flatten the curve, to ensure that when our hospitals need to lean on their capacity, they have the ability to care for those that need it. We continue to watch this situation evolve rapidly, and there are, in our state, definite reasons for concern. So again, I continue to encourage people to be armed with knowledge, to do what you can to protect yourself and your families, to stay home, and we'll continue to follow along with you on a daily basis. Thank you.
I also want to mention our videos that we have online that we talked about yesterday, the karate video. We have different things that we're putting online for not just parents, for kids. Life has to continue on, and we got to find that new norm. And again, parents, and not just parents, adults, keep yourself busy. Do some things around the house, or just find some stuff that you can do to get through this. And we will get through this because we're New Yorkers. We're going to get through this.